Good afternoon, everyone. We'll get started in just a minute as we let everybody in. Good afternoon, everyone, and thank you for joining today's Maternal Health Stakeholder Webinar hosted by the Department of Health and Human Services. I'm Karen Marks with the HHS Office of Intergovernmental and External Affairs, and I lead on maternal health engagement and partnerships with states and organizations. I think everyone on this call is aware that in the U.S., the mortality and morbidity rates for people giving birth are too high, and the disparities in the outcomes are not acceptable. The Biden-Harris administration and HHS are prioritizing this issue and continue to seek out innovative ways to better understand and address the underlying causes that perpetuate this crisis. At the department, Secretary Javier Becerra always tells us to go big and be bold. We have taken that to heart and are doing just that. We are laser focused on improving maternal health outcomes by showing results and successes in both big and small ways to scale and spread across the country in our efforts to improve health outcomes for people giving birth. Today, we will hear from leaders across the department on their agency-specific activities designed to raise awareness and education for all types of providers and patients to ensure access to care, to improve the quality of care delivered, including through ensuring that care is respectful of patients' preferences, and through the enactment of programs and policies designed to expand and diversify the workforce and overall improve maternal health outcomes. You will hear from the latest research efforts, data releases, state programmatic activities, and a call to action on how you can become more involved, particularly on the maternal mental health front. Before we begin, a few housekeeping items. This briefing is open to the public and being recorded. We will send out the recording and links to any resources mentioned in the coming days. Any press inquiries for HHS should be directed to the press office at media@HHS.gov. There will be time at the end for Q&A, so we encourage you to submit your questions using the Q&A function at the bottom of your screen at any time during the briefing, and we will get to as many of the questions as time permits. We did receive several hundred questions in advance, so we will do our best to answer as many of those as we can, while also reserving some time for questions submitted in real time. For your awareness, the chat has been disabled today due to the number of participants on the call, but please feel free to drop your questions in the Q&A as we go along. And with that, I will turn it to HHS Secretary Becerra's counselor, Dr. Stephen Shaw, for a few remarks from the Secretary's office and to share more information about the Secretary's Postpartum Maternal Health Collaborative. Over to you, Steve.
Thanks, Karen. Appreciate it. And thank you all for joining. I know we share this priority. Maternal health is a top Biden-Harris administration priority, and I want to be clear that goes for the Secretary of HHS as well. He prioritizes this both in his daily work, but also in his personal perspective. His wife is a practicing high-risk OB doctor. So we talk about this issue a lot and what this department can do to further explore this critical topic. The White House released their seminal maternal health blueprint in 2022. We'll hopefully put that in the chat. And since then, this department has disseminated a record level of funding and resources to address maternal mortality and morbidity. And then posted a recent fact sheet just a few months ago, updating on that blueprint, on that work across administration, what we've done since the release of that blueprint in 2022. And during today's call, you're going to hear more about all of this fabulous work from all of our experts across the department. I'll kick off the review of our work across the department by highlighting one effort that's actually happening out of the Secretary's office directly. So earlier this year on Valentine's Day, we launched the HHS Secretary's Collaborative on Postpartum Maternal Health, which focuses on addressing postpartum mortality through a collaborative quality improvement framework. Well, what does that mean? We know, and many of you know, that we've seen and made some progress on maternal mortality in the inpatient setting. There's more to do, of course, but we also recognize that the majority of moms' deaths are happening after birth? How can we build on the successful work we've had on some inpatient settings and ensure that people receive high quality and, most importantly, respectful care after they leave the hospital? Besides being this initiative spearheaded by the Secretary, which is the Secretary's collaborative, what's also novel is that we're trying to bring to bear all of our experts across the entire department to help inform the initiative and the states. So we asked states earlier this year, there's no funding involved here, but we said to the states, if you want to dig deep within your state, we want to dig deep with you. So 6 states responded to that call, and we're working with those 6 states to provide them with technical assistance, our team of quality improvement clinical experts, data resources, and again, that ability to do a deep dive from across our experts. 3 of those states are focusing on issues relating to behavioral health, including mental health and substance use disorder, and 3 are focusing on how to improve outcomes for individuals with hypertension and other cardiac-related conditions. So we've been working with those and gleaned some important insights about what that intervention should look like. And we've launched recently with many of those states to begin that quality improvement process, even in the short duration that we've had since Valentine's Day. At the end of the year, we will share some of our lessons learned, both big and small. Our goal wasn't to solve postpartum maternal mortality in this year-long period, but it is really to get a snapshot of what success could look like at all levels: family, provider, state, federal level. And our hope is to take some of those initial lessons and translate that to our ongoing federal programs. And would note that models like ARPA-H Heroes and CMMI TEMA are launching at a perfect time to leverage these lessons. I do want to leave time for my colleagues who are doing amazing work, but on behalf of the Secretary, I just want to thank all of our colleagues presenting today, but most of all, I want to thank all of you for your interest and your ongoing commitment to this critical issue. And with that, I'll turn it back to Karen.
Thank you, Steve, and for providing the Secretary's perspective. And we are sorry he was unable to join us today. But as you can tell from a secretarial named initiative, how important this issue is to him. We now have a number of our HHS agencies with us to share information on their current work and the vision going forward. First, we will hear from Dr. Dora Hughes, the Chief Medical Officer and Director for the Center for Clinical Standards and Quality at the Centers for Medicare and Medicaid Services. Dr. Hughes, over to you.
Thank you. And thank you so much for inviting me to join this event this afternoon. With leadership from this administration and CMS Administrator Chiquita Brooks-LaSure, CMS is using the levers and authorities at our disposal to improve maternal health care and outcomes across all components. I'm just going to share just a few examples today, and I'm going to start with the CMS Innovation Center, also known as CMMI. The CMS Innovation Center designed the Transforming Maternal Health, or TMA, model to protect the health and well-being of pregnant women and their newborn infants. The model will test whether targeted and funded technical assistance to state Medicaid agencies, combined with the development of a new payment model, can support successful implementation and expansion of the very best evidence-based maternity and postpartum care. It aims to support whole person care that makes mothers feel empowered, safe, and healthy throughout their pregnancy, childbirth, and into the postpartum period. The TMA applications were due last week, and we were excited to receive a number of very robust applications. CMS is in the process now of reviewing these applications to select participating states, and the model will begin in January of 2025. Now, if I turn my attention to the Center for Clinical Standards and Quality, or CCSQ, as many of you know, CCSQ is responsible for quality of care in nearly every facility in this nation. Of relevance to maternal health, hospitals participating in the Hospital Inpatient Quality Reporting Program, or IQR, are now required annually to complete a structural measure question that assesses A, whether or not a hospital is participating in a statewide or national perinatal quality improvement collaborative, and B, whether it is implementing patient safety practices and/or bundles related to maternal morbidity from the QI collaborative. Based on this structural measure, CMS launched the first ever birthing-friendly designation on the CMS Care Compare website, which we hope will help expecting mothers and their families find a hospital with a commitment to improving maternal quality care. Additionally, CCSQ finalized the adoption of 2 new maternal health quality measures. One is a measure of severe obstetric complications occurring during the delivery hospitalization, such as hemorrhage. And the second is a measure of low-risk cesarean section rates, which describes the share of patients with low-risk pregnancies who give birth via C-section. Finally, earlier this year, CMS has proposed to expand hospital conditions of participation, or COPs, to better address obstetrical care, including OB staff training, revisions to quality assurance and performance improvement programs to measure and track indicators of OB health outcomes, to incorporate maternal mortality review committee data, and conduct at least one performance improvement project. And the proposal also addresses emergency readiness and transfer protocols. We have sought comment on these proposals, and we're in the process of reviewing these comments, revising the proposals, and we hope to finalize later this year. And finally, I'm going to turn my attention to our colleagues in Medicaid and the Center for Medicaid and CHIP Services, or CMCS. Thanks to the American Rescue Plan Act of 2021, or ARP, states can provide continuous Medicaid and CHIP coverage for a full year after pregnancy, up from 60 days prior to the passage of this act. CMS has now approved the 47th state, in addition to DC and the Virgin Islands, that has extended its Medicaid program to cover postpartum care. This extended coverage option offers states an opportunity to provide care that can reduce pregnancy-related deaths and severe maternal morbidity, and improve continuity of care for chronic conditions. I'll stop here for sake of time, but before I hand the mic back, I want to thank you. Thank you to all of my sister agencies and offices participating today, and to so many of you who have and continue to be amazing partners, and all that we are doing at CMS to improve maternal health care and outcomes. Thank you, and Karen, back to you.
Thank you, Dr. Hughes. We'll now turn it to Jordan Grossman, the Deputy Administrator for the Health Resources and Services Administration, or HRSA.
Thanks, Karen, and thank you to everyone joining today. It's a pleasure to be with you and to be with so many wonderful colleagues. As some of you may be aware, HRSA is home to a wide range of federal programs that support pregnant women, moms, and their families. And we're really excited to have made a number of announcements recently to address the maternal health crisis and really support that White House blueprint effort and the secretarial priority that Steve and Karen have mentioned already. In fact, this year we launched, as part of our commitment to improving maternal health, a year-long Enhancing Maternal Health initiative, which is focused on really accelerating all of our cross-agency work at HRSA in addressing maternal mortality and related disparities, but also improving partnerships with people with lived experience, our grantees, community organizations, and state and local health officials across the country. We've had statewide convenings so far in Missouri, Georgia, Arizona, Montana, Maryland, Kentucky, and Michigan, and there'll be more to come. And we've been really heartened to see the incredible collaboration and work that's been happening across the country through that initiative. But I wanted to highlight a few specific announcements from the last few months about our efforts to really advance maternal health. First, I want to talk about a maternal, infant, and early childhood home visiting program, which is a wonderful program where nurses and counselors or other trained individuals can voluntarily come in and provide ongoing support to families, particularly in communities at risk for poor maternal and child health outcomes. We were very proud in 2022 that President Biden signed bipartisan legislation doubling funding for the program, which is the first expansion of federal home visiting program funding in nearly 10 years. And then last month, Vice President Harris announced over $440 million in support for this program, across the country. This is the first time we are making not only base awards to that program, but also matching grants for that program to really expand the impact. And with that increased funding, we estimate an additional 28,000 parents and children would be able to receive home visiting services compared to the prior year. I also wanted to talk about our Healthy Start program, which provides funding to community-based organizations across the country to support pregnant women and their babies who are up to 18 months old. The Healthy Start program is just a fantastic program in communities across the country. We have over 100 awards, and it does things both from providing services to providing education and to even linking folks with things like housing supports or educational opportunities or even job opportunities. It's a foundational program for us because it really is based in the community, and we're really proud of the results. And we were very pleased to announce this past April $105 million in Healthy Start funding across the country. We also have at HRSA, we're the home to the Community Health Center program, where we support more than 1,400 health centers that have nearly 15,000 sites across the country. And of course, they're essential providers of maternal health care. We're serving nearly 15,000 more prenatal care patients than we were 4 years ago. And just this last week, we announced $240 million in awards to launch or expand mental health and substance use disorder services in more than 400 community health centers across the country. Those, to give you a sense of scale, those 400 health centers, they serve 10 million people. And so we're really thrilled to be able to be expanding access to behavioral health services, since we know, as so many of our colleagues on the screen do, that behavioral health conditions are such a huge driver of maternal mortality. Finally, I wanted to just highlight some of the work that we've been doing in rural communities to enhance maternal health care. In June, we awarded $8 million through our Rural Moms program to really build networks and enhance access to healthcare in rural communities across the country. We also announced $11 million for our rural residency program, including the first ever obstetrics and gynecology rural track program. We're super excited about that and hope that's a model for more going forward. And finally, just this past week, we announced nearly $9 million over 4 years to 5 organizations in the South to expand access and coordinated healthcare services before, during, and after pregnancy in rural communities. As you can see, we're extremely dedicated to advancing maternal health in every way we can across our programs, particularly in high-need communities across the country. We really appreciate your partnership and the partnership of all of our sister agencies. And with that, I'll turn it back over to Karen.
Thank you so much, Jordan. I'm now going to turn it to Dr. Diana Bianchi, the Director of the National Institute for Child and Health Development with the National Institutes for Health. Dr. Bianchi, over to you.
Thank you, Karen, and it's great to be with all of you. I'm representing all of NIH today, and I'm grateful to join all of my colleagues and partners on this call to provide you with an update on NIH activities to address the leading causes of maternal morbidity and mortality and to reduce preventable maternal deaths. One major program is the NIH-wide Implementing a Maternal Health and Pregnancy Outcomes Vision for Everyone, otherwise known as IMPROVE, which works to reduce preventable causes of maternal deaths and improve the health of women before, during, and after delivery. It includes a special emphasis on disproportionately affected populations, such as racial and ethnic minorities and rural populations, among others. To date, the IMPROVE initiative has supported 4 main activities. The largest one is the Maternal Health Research Centers of Excellence, which includes geographically diverse research centers, primarily in maternity care deserts, to implement community-driven interventions and conduct research on maternal health disparities. In fiscal year 24, the IMPROVE initiative received an increase of $10 million over fiscal year 23 appropriation levels, and we're very grateful to Congress for giving us that. And with that money, we were able to add 2 new maternal centers of excellence at the University of Illinois, Chicago, and the University of Pittsburgh for a total of 12 research centers. The Improved Community Implementation Program supports community engaged implementation science research, and we were able to add a new program at Thomas Jefferson University in Philadelphia, focusing on intervention related to a maternal substance use disorder. We've made great use of a couple of challenges. One is the Connecting the Community for Maternal Health Challenge. And the idea behind that is to support community-based organizations so that they can develop the capabilities, infrastructure, and experience to conduct research projects that seek to improve maternal health outcomes in their local communities. And we recently announced the winners for this challenge, including a project to test the effect of an infant carrying intervention to improve lactation and reduce postpartum depression among Black parents. And also, we funded an organization that developed a data-driven tool to identify maternal risk factors and pregnancy outcomes. The other challenge that we have going as part of Improve is the Radix Tech Maternal Health Challenge, which uses a Shark Tank approach to incentivize development or adaptation of home-based or point-of-care diagnostic devices, wearables, and other remote sensing technologies to improve postpartum health care, particularly in the over 1,100 maternity care deserts in this country. And those winners will be announced in early October. Improve is also supporting additional new projects that will address intimate partner violence and new models of care to reduce health disparities and structural racism. We're going to hold a hybrid 5th anniversary meeting, October 15th and 16th, on the NIH Bethesda campus. And then NIH institutes and centers separately are supporting research programs that are consistent with their mission areas to advance research in maternal health, including NICHD's Maternal Fetal Medicine Units Network, the NIH Office of Disease Prevention, which sponsored a Pathways to Prevention program to address maternal and postpartum health. The National Institute of Mental Health is working to prevent perinatal depression through improving interventions for at-risk individuals. The National Institute of Diabetes and Digestive and Kidney Disease supports research to understand metabolism and gestational diabetes. And the National Heart, Lung, and Blood Institute's early intervention to promote cardiovascular health in mothers and children addresses cardiovascular health for mothers and children through a home visiting program. And then the National Institute on Drug Abuse supports research to optimize the safety and efficacy of opioid use disorder medications for pregnant people. And lastly, the National Institute of Nursing Research has an initiative to advance integrated models of care to address healthcare access or quality, as well as social or structural inequities to prevent adverse pregnancy outcomes. So you see, we have a lot going on at NIH, and through this work and collaborations with our partners across HHS, we aim to make progress towards reducing maternal morbidity and mortality, improve maternal health outcomes, and advance maternal equity for all. Thank you.
Thank you, Dr. Bianchi. Next, we'll hear from Dr. Wanda Barfield, the Director of the Division of Reproductive Child Health at the CDC.
Hello, everyone. I'm really happy about the opportunity to speak with you and update you on some of CDC's work supporting young families. CDC is fully committed to eliminating preventable maternal mortality in the U.S. and ensuring the best possible birth outcomes for all women. As you know, state maternal mortality review committees, or MMRCs, get the most detailed, complete data on maternal mortality and then develop actionable recommendations for prevention. MMRCs comprehensively review every pregnancy-related death and circumstance.
Wanda, you're on mute.
Can you hear me now?
Yes, we got most of what you said, just that last couple of sentences that accidentally
Oh.
unmute.
Yes. So these robust data from maternal mortality review committees drive action and are the cornerstone of CDC's prevention efforts. Last month, CDC was pleased to announce and invest almost $120 million over 5 years through the Enhancing Reviews and Surveillance to Eliminate Maternal Mortality, or ERASE program. And this support of MMRCs is in 46 states and 6 U.S. territories and freely associated states. In the first 5 years of the ERASE program, we've seen considerable growth, including increasing implementation of data-driven recommendations from MMRCs, with over 230 actions taken based on MMRC data last year alone. MMRCs also link with perinatal quality collaboratives, and PQCs provide key infrastructure that supports quality improvement efforts addressing obstetric as well as newborn care and outcomes at the population level. And they can drive change based on MMRC data recommendations. In addition to the work on things like hemorrhage and hypertension, increasingly PQCs are working to improve birth equity and respectful care. We're excited to share that CDC is working with the CDC Foundation, with support from Johnson & Johnson, to expand quality improvement to increase respectful care through PQCs, including using CDC's Hear Her campaign. Now, the Hear Her campaign is designed to increase awareness among pregnant and postpartum women and their support systems about urgent maternal warning signs. And in addition, it provides resources to support clinicians to really listen to their patients and provide respectful care so that timely diagnosis and treatment can be made. We've recently released several new resources, including several new videos. As we continue to support ongoing state-based surveillance of maternal behaviors, attitudes, and experiences before, during, and shortly after pregnancy through the Pregnancy Risk Assessment Monitoring System, or PRAMS. And earlier this year, we introduced a new process that's going to make data far more accessible to researchers through the Automated Research File web portal. A few weeks ago, the 2022 birth cohort of maternal and infant health data were added. The data also included information about social determinants of health for 22 sites that chose to implement it in 2022. And as you can tell, CDC has a lot going underway, and we're grateful to all of you who are working to improve maternal health with us. Together, we can protect the health of pregnant women and support young families to ensure each child, parent, and caregiver has the chance to thrive. Thank you so much.
Thank you, Wanda. We'll now hear from Sarah Boateng, the Chief of Staff for the Office of the Assistant Secretary for Health. Sarah, over to you.
Hello there, and good afternoon. Here I am. Hello and good afternoon. I'm honored to be with you today with my colleagues to share the work our office has done to advance maternal health. Maternal health is a top priority for our office, the Office of the Assistant Secretary for Health. We work across our offices to support the health and well-being of moms and their families. One example of this work is our HHS Office of Women's Health initiative, Maternal Morbidity and Mortality Data Analysis. This multi-year initiative leverages a large, nationally representative database and utilizes performance improvement methodology to scientifically identify drivers of maternal and infant mortality and morbidity and implement solutions. The information and its analysis is used to inform policy and identify evidence-based practices necessary to improve maternal and infant health outcomes. In addition, we have developed the Perinatal Improvement Collaborative, a large-scale effort to unite a cohort of over 200 hospitals from every state and the District of Columbia that collectively provide over 500,000 births a year. The Perinatal Improvement Collaborative implements and analyzes evidence-based interventions to enhance quality improvement in clinical settings and advance health equity. Our Office of Women's Health is right now developing a report summarizing the information from the participating hospitals, and the report will be available later this year. We have also focused on the prevention of violence during pregnancy and the postpartum. The office established the Violence Against Women and Substance Use Prevention Initiative, which issued grants to support pilot programs in Texas, Kentucky, West Virginia, Mississippi, Virginia, and Hawaii. The state-level programs educate and train providers of substance use disorder treatment to identify intimate partner violence during pregnancy and postpartum. And finally, as you have heard from many of my colleagues, maternal mental health has been the focus of this administration. And in response, we launched a new health communications campaign, Talking PPD. The campaign is designed to decrease the stigma of postpartum depression and increase the self-efficacy of women to seek help. The campaign shares deeply personal stories of women who have experienced postpartum depression and received support and treatment. And it aims to increase awareness of postpartum depression symptoms, the visibility of reliable resources, and understanding of ways to access care. Thank you for the opportunity to highlight a number of initiatives from the Office of the Assistant Secretary for Health. For more information on these efforts, please visit womenshealth.gov. Back to you, Karen.
Thank you, Sarah. Next, we'll hear from Shalini Wickramathilaka, from a senior advisor at the Substance Abuse and Mental Health Services Administration, or SAMHSA. Shalini, over to you.
Thank you so much, Karen. Thanks for bringing us all together today. SAMHSA's mission is to lead efforts that promote mental health, prevent substance misuse, and provide services to foster recovery. And we know that addressing maternal mental health and substance use conditions is a crucial component of addressing overall maternal health. 1 in 7 people experience behavioral health disorders during the perinatal period. And as Jordan noted earlier, we know that overdose and suicide are some of the key drivers of maternal mortality. SAMHSA has been increasingly involved in helping to address this issue, along with our incredible sister agencies on this call here today. Last September, in partnership with the Office of the Assistant Secretary for Health, SAMHSA launched the Maternal Mental Health Task Force. This task force has developed a national strategy to improve maternal mental health care, as well as an accompanying report to Congress on the topic. And these documents identify best practices and make recommendations to improve federal activities regarding maternal mental health and substance use disorders. In connection with the 1-year anniversary of the launch of this task force, HHS is expanding efforts to advance maternal mental health and substance use. And as Karen noted up top, we have a call for action. We would love to learn about any new initiatives that have the potential to improve maternal mental health and substance use awareness and services across the country. So we're asking any interested organizations to submit commitments highlighting new initiatives that address maternal mental health and substance use care. If you're interested in learning more, feel free to contact Dr. Centrise Bellamy in the Office of the Assistant Secretary for Health, and we'll put her email address in the chat. Once you reach out to Dr. Bellamy, our team will follow up to discuss commitment ideas, and we'll be collecting commitments through November 15th, and then we'll announce them publicly in early 2025. In addition to the Maternal Mental Health Task Force work with OASH, I wanted to mention some of the grant programs that SAMHSA has focused specifically on maternal mental health and substance use. Our longstanding pregnant and postpartum women's services grant programs support a comprehensive family-centered approach in substance use treatment, allowing moms to bring their kids into treatment facilities with them. Over the summer, the Biden-Harris administration announced nearly $30 million in new funding for 2 new women's behavioral health programs. The first is our new community-based maternal behavioral health services grant, which aims to improve access to services by strengthening community referral pathways. And the second is the Women's Behavioral Health Technical Assistance Center, which will offer support to healthcare providers to make sure that they know the best practices for addressing women's behavioral health across the lifespan. We have state learning communities on this topic to help states improve their maternal mental health and substance use policies. We have a longstanding partnership with the Administration for Children and Families focused on offering technical assistance on substance use and child welfare. The list goes on and on. I won't go over all of them, but just want you to know that SAMHSA is working hard to improve the mental well-being of all Americans, but we certainly recognize the unique challenges faced by pregnant and postpartum people, and we are working to continue specifically to support this population. So with that, back to you, Karen.
Thank you, Shalini. Next, we'll hear from my colleague, Reverend Dr. Q English, the director of the Center for Faith-Based and Community Partnerships. Q, over to you.
Thank you, Karen, and thanks to everyone on this call doing the great work you are doing in improving maternal health outcomes. In 2023, the Center for Faith-Based and Neighborhood Partnerships at Health and Human Services launched the Moms Tour, Maternal Outcomes Matter Showers. The Moms Tour was created in sync with the White House blueprint for addressing the maternal health crisis, championed by our very own Vice President Kamala Harris, which focuses on a comprehensive approach to improving maternal health outcomes and reducing disparities. The blueprint's key components focus on racial and ethnic disparities, community-based solutions, strengthening the maternal health workforce, improving data and research, supporting mental health and community and patient engagement. So the Mom Tour connects pregnant and postpartum women to services and resources. We all know the U.S. has one of the highest maternal mortality rate to any developed nation in the world. But we also know that 80% of pregnancy-related deaths are preventable. So this was the driving force. This is why we are showing up in communities that need us the most, recognizing that Black women's pregnancy-related death rates are 3 times higher than their white counterparts, and American Indian, Alaska Native are 2 times higher. We also know that suicide is the leading cause of death for postpartum women from 6 to 12 months, and congenital syphilis is on the rise, and the overall rate of syphilis in mothers giving birth in the United States more than tripled from 2016 to 2022. So on every leg of the Moms Tour, we connect them to much needed resources. In essence, connecting them to the village many of them didn't know existed for them. We also have a separate gathering for dads and dads-to-be, knowing that it's not I'm pregnant, it's we're pregnant, helping to support their own challenges from postpartum depression to suicidal ideations. So in partnership with our federal agencies, we have provided support for mental health services, healthcare coverage, lactation, breastfeeding support, doula and midwifery services, information on substance use disorder and syphilis, postpartum depression, health screenings, vaccinations, and more. And lastly, we educate them on how to advocate for themselves in healthcare settings, and using the Hear Her Concerns, You Know Your Body Best campaign, which was produced by CDC, we teach them about urgent warning signs and how to talk to their healthcare provider. Last year, we connected over 5,000 women and families to resources and services. This year, we have targeted 25 cities and states with high maternal mortality and morbidity rates. And to date, we have traveled across 12 cities and connected over 7,500 women and families. And we're not done yet. This weekend, we're going to be in Albuquerque and Rapid City, South Dakota, and we invite you to collaborate with us on the remaining legs of the tour and to hear how you can bring the Moms Tour to your city. So write us at partnerships@HHS.gov. That's partnerships@HHS.gov. And lastly, this year at our 2nd annual Black Maternal Health Outcomes Matter Summit, we released the first Faith in Action on Maternal Health Guide, a toolkit on things faith-based and community-based organizations can do to improve maternal health outcomes in their communities. So finally, we all know that a safe pregnancy, a safe delivery, and appropriate postpartum care is a right and not a privilege. So we here at the Biden-Harris administration at Health and Human Services, we aim to make the U.S. one of the safest places for women to give birth. Back to you, Karen.
Great. Thank you, Q, for those comments. Next, we'll hear from Patricia Yurchik with the Advanced Research Projects Agency for Health, or ARPA-H. Patricia, over to you.
Thank you. I'm Patty Yurchik. I'm one of the science and technical team members for the HEROES program at ARPA-H. Dr. Zangavi is unable to join today due to a travel delay, and he asked me to provide an update on the HEROES program on his behalf. So the HEROES program is an innovative approach to create financial incentives to improve 4 outcomes in large regions, one of which is maternal complications. We encouraged over 40 applicants in our first round of our application process, and we are currently in our full proposal submission period, which ends November 15th. We expect to award our performers at the end of this year. We anticipate the program starting in the early part of 2025. I encourage you to learn more about the HEROES program on the ARPA-H website. And one of the other things that we are very proud of that we did for the HEROES program is create a HEROES toolkit, which is an interactive toolkit for the 4 outcomes. The other 3 outcomes are opioid overdose, alcohol-related health harms, and ASCVD risk score, 10-year risk score. The toolkit is, as I mentioned, interactive. You can select one of the 4 outcomes. You can select your specific geographies, whether it's at a county or a zip 3, a whole entire state, and you can see how the outcomes are tracking in those regions. So I encourage you to visit the toolkit as well. And thank you.
Thank you, Patty. And before we open it up for question and answer, I just want to provide a brief update on the Newborn Supply Kit Initiative, an initiative that stemmed from an executive order on how do we make it easier for people to access federal government benefits and programs at the time of birth. Through a public-private partnership with Baby to Baby, we began piloting this program in 2023 by distributing kits to hospitals and community-based organizations. The initiative provides new families with a kit of goods and educational information at or around the time of birth. In May of 2024, HHS and our partner Baby to Baby announced a new partnership with Huggies, which allowed for the expansion of the pilot phase from delivering the 3 kits in 3 high-need states to delivering 10,000 kits across 10 partner states. And we've expanded our distribution partners from hospitals and CBOs to include federally qualified health centers as well. We're excited to share that our evaluation is demonstrating that this kit is really improving maternal mental health outcomes by decreasing financial and emotional stress, as well as improving trust in government. We are looking to expand the initiative in 2025 and welcome any interested people to reach out to us. And the email will be, with more information, will be in the chat. With that, I'm going to invite everybody to come onto the screen. You will see all of us now, Brady Bunch style. And we will open it up for question and answer. Great. I'm going to start with some of the questions that were submitted. The first one, and I think we'll have a number of people to respond to this one. What federal opportunities are there for local governments and nonprofits to improve access to maternal health services? Jordan, I might start with you on that one.
Sure, that's a great one. So there's a few different ways local governments and state governments can get involved. The first I would mention that I didn't mentioned before is our maternal and child health block grant that goes to every state. It's a really important resource. It's also very flexible, and it's really a partnership between HRSA and states. And lots of states are doing fantastic work with that funding. The second I would mention is the home visiting program. Again, funding that goes to every state, and just highlighting both that the funding, due to that bipartisan law that President Biden signed has increased significantly. And that includes our funding for tribal communities. The set aside for tribal communities has actually doubled in that law as well. So there really should be some opportunities there. The third, I would say third and fourth, both the Healthy Start program and the Health Center program, they're both really, they build on community-based organizations, some of which are, officially state or local government affiliated, and some are just longtime respected folks in the community. There are so many across the country. If you go to HRSA.gov, there's many ways you can find it, or we can follow up afterwards and really connect you to folks who are doing some great work in the community to advance maternal health and find some innovative approaches. I think some of the work that Dr. Hughes has mentioned, we've been trying to support some innovative work through those channels. I'll stop there because I know I'm sure other folks have things to add.
I'm happy to piggyback off of something that Jordan mentioned. So SAMHSA similarly has block grants that go to states, one focused on mental health and the other focused on substance use disorder treatment. And I think a really good way of kind of moving things forward is to build relationships with the folks in the states who manage those dollars. So the single state authority for mental health services, the single state authority for substance use services, there are a lot of funds going to states to address mental health and substance use, including those dollars specifically for maternal health issues. And I just encourage partnership with the folks who at the state level who are leading these efforts.
And Karen, this is Sarah. I'll add just two more, which is our Office of Women's Health is continuously seeking partners for our Women's Health Champion program. So you can find information at womenshealth.gov, and we encourage state and particularly local organizations to become champions with us for women's health, including maternal health. In addition, our Office of the Assistant Secretary for Health has regional leaders in all 10 HHS regions around the nation. If you don't know your regional health administrator, visit HHS.gov, find information there on who they are, and reach out and make that connection. They're individuals who can be your first line of contact when needing to find out who and how to connect with people here at HHS.
Some of the work that we're doing locally is utilizing the Hear Her campaign to have more local outreach, and we recently funded some communities to look at how they could tailor those materials more for a local level use. The materials are available for local use, and if you go to one of the links that we sent in the chat, we're happy to help communities to tailor that information for local audiences. Thanks.
And just to weigh in from CMS, for all of our, for many of our models, if not all of them, if they are focused on states, when we review applications or we decide who should be participants, we look in fact to see how they're partnering at the local level. How are they partnering with what is local government? How they're partnering also with tribal communities? How are they partnering with the state, with the various agencies? And so I think that's a really important question and always a consideration for us. I would even say stepping out even at a higher level, for us, we do hear from many local governments and other organizations at the who are directly working on the ground with our beneficiaries in our case, and rely on their expert input. We, particularly as it comes through our CMS locations, our regional offices, to find out how are our policies working? How are our programs being implemented on the ground? What are some of the changes that that we need to make? And we do actually try to do this in a rigorous and systematic way to capture those lessons and share them internally. So I do think, again, that's just a really important question. And as you can see across all the federal agencies, something that's a priority for all of us. While I do have the mic, I would have to say that clearly I misspoke based on, I noted a couple of questions in chat. It's 47 states, including DC. I know many people are forever trying to make DC a state, but it is, in fact, 46 states plus DC and the Virgin Islands and not including. So I just wanted to make that clarification on the record. So thanks for those that pointed out that I misspoke on that. So I'll turn it back over to you, Karen.
Thank you. Our next question, I think everybody on this, all of our panelists will be excited to address. How do each of the agencies and offices collaborate to not duplicate, but instead to share lessons learned across your disparate agencies? I'm going to start with Steve on this one, and then we can go around.
Yeah, I mean, I would actually credit the other folks on this call with ongoing collaboration without the Secretary's office needing to come in and do that. There are multiple sort of cross-agency calls that happen across the department where everyone gets together, certainly at least monthly, more frequently when we're talking about things like budget, whenever policies or launches go out that get circulated across. Want to credit the Office of Women's Health at OASH for helping enable this coordination, as well as our Assistant Secretary for Planning and Evaluation. You all don't care about necessarily all those acronyms, but just to say, there are touches where all the people on the screen are looking at each other in the face and saying what's going on around the department, and looking for opportunities in particular to say, how can this step up? How can that? And I would say that, again, that's not even being driven by the Secretary's office, but what I talked about at the top of this call, which is really the Secretary's collaborative on postpartum maternal mortality, came out of a cross-departmental conversation that said, hey, look, we really need to think about what's happening on the postpartum space, not individual to any one agency. And I think a lot of people on the screen said that almost directly to us when we were talking about this, and where can we think about sort of doing an exploratory effort in partnership with states. So that's all to say there's a lot happening. I think it helps when the White House really asks us to do things like those fact sheets and blueprints. And I think we both posted the 2022 as well as the 2024 fact sheet. I think we should, we continue to do calls like this to be sure everyone's tracking. But yeah, there is a lot. We totally understand that it's hard for sometimes the field to understand how all these pieces are fitting together. So welcome the feedback. I can only tell you that we are trying we're working our butts off to try and coordinate internally.
I'm happy to weigh in here as well. I think I mentioned in my remarks our birthing friendly designation. I think that's an excellent example of how we're working across the agencies. Our CMS team is working to directly connect CDC and HRSA with hospitals that did not receive the birthing friendly designation because they either A, they don't provide labor and delivery services, or B, they are not participating in a perinatal quality improvement program to provide technical assistance and resources. And more specifically, HRSA is providing the TA to ensure that hospitals that are not providing L&D services can still provide high quality obstetric care in the emergency department as needed. And we are working directly with CDC for hospitals that are not participating in a perinatal quality collaborative that CDC's and CMS together is encouraging these hospitals to participate in a CDC-led perinatal quality collaborative. So I think there's so many other examples that we could share, particularly as CMS. We are heavily reliant on the expertise and the resources and the authorities that our sister agencies have, and it just makes for much richer policies and programs here at CMS.
Yeah, another area that I think has been important has been the collaboration on better understanding of the causes and issues around stillbirth. That's been a very important issue, and through the council that led that effort in terms of better understanding the research and led by NICHD. There was collaboration with CDC and HRSA as well in terms of understanding those factors and issues. And it's been a great opportunity to work together in terms of improving surveillance, research, as well as understanding issues that affect birthing people. So it's been, lots of opportunities to work together in many different ways. And all of the folks here have been fantastic, and we do meet a lot.
Yeah, I would add to what Wanda said, and in addition to addressing specific issues that were requested by Congress, we added a special session on people with lived experience of stillbirth, which was extremely important in terms of shaping the recommendations. Was probably one of the hardest things we'd ever done, listening to these tragic experiences, but it was a great example of how agencies work together.
Happy to add to the Maternal Mental Health Task Force that OASH and SAMHSA are co-leading, has really brought all of the federal agencies and all of the HHS operational divisions together to tackle this issue kind of collectively and collaboratively. We have over 100 members of the task force, and it includes both federal and non-federal members, and it's incredible how folks continue to show up. It's a ton of work that goes into the task force and the deliverables there, but I think everyone here and even beyond this group is really just so committed to the behavioral health piece of the maternal mortality and morbidity crisis.
Okay, I think we have time for one more. I'm going to ask another one that I think touches on many of the agencies, and we received a number of questions about in terms of the workforce. How do we, and especially in light of the healthcare professional shortages, how do we both retain the current workforce and expand, and most importantly, diversify the workforce for maternal health? Jordan, at HRSA, I'll start with you.
Yeah, I was going to say that you're basically summarizing one of our key priorities or functions. At HRSA, we have a Bureau of Health Workforce, and we're focused on growing the workforce, diversifying the workforce, and importantly, sustaining and supporting the current workforce. We do that through a number of different programs, but we're also really open to feedback. I think we've heard from, probably many folks on this call and many others, how critical of an issue this is across the board. I'll mention a few programs. We have the National Health Service Corps, which provides scholarships and loan repayment assistance. We've got it's ranged from 18,000 to 22,000 participants in the field during this administration. We've reached the historic highs in that, and that's in exchange for scholarship and loan repayment assistance. You will commit to working in a high need area. And one thing we've seen from that and several of our other programs is that really getting those training programs or those initial years in high need communities, folks tend to stay. We have data showing folks really stay, and that's one thing we've heard, particularly from our rural communities and other high need communities, about we need folks who are going to serve this community for the long term. I mentioned some of the residency programs on the rural training side of the house. We also have a teaching health center program, which we really like to talk about because it brings that residency training out of the hospital and into the community and a lot of health centers and other community settings. Again, another area where we see folks staying in the community that they start their career. And I also just wanted to mention we have a number of programs that are beyond at the physician level. We have it all across the workforce. The behavioral health workforce education and training programs is a good example where we have folks, peers and other things. We have programs around midwives and our Maternal and Child Health Bureau. The list goes on and on. The last piece I wanted to mention, though, is around diversifying the workforce. We have several programs that are specifically geared towards diversifying the workforce and, importantly, to identifying folks early in their lives when they're making decisions about careers to get them into health careers at the outset. We have our scholarships for disadvantaged students and our Centers of Excellence program. But one thing we've heard over and over again is really making sure that it's clear that this is a pathway to a great career that's meaningful, that provides a great way to make your life, we think is really important, and I think we're particularly eager to hear from folks on that. And final thing I will say is, towards the last question, I think we've worked with every single other optive on this screen about workforce challenges. So I think this is something across HHS and the administration that we're really laser focused on. But I'll stop there because I'm sure everyone has other things to say.
Karen, this is Sarah from OASH. I want to highlight the work of the U.S. Public Health Service Corps here. So as addition to supporting the workforce growth across the nation in some very specific places, HHS or our federal sister departments provide direct clinical care, and often that clinical care is provided by members of the U.S. Public Health Service Commission Corps. So they provide clinical care at Indian health reservations, in federal bureaus of prisons, at national park health clinics. So we're constantly looking to grow the U.S. Public Health Service Corps so we can increase our footprint across the nation.
I want to highlight SAMHSA's Minority Fellowship Program, which aims to diversify the workforce, particularly for those entering the behavioral health field. I'll put a link in the chat. I know we're out of time, but I just wanted to flag that.
Yeah, another work that we're doing collaboratively with HRSA is building the maternal child health epidemiology workforce and field. Of course, that includes not only those involved in clinical care, but also MCH epidemiologists. We have fellows through the Council of State and Territorial Epidemiologists. We have EIS officers at CDC. HRSA also has GSIP fellows. There are lots of great ways to build the capacity. We recently had a conference in Seattle where we see that the future really looks good. And we're excited about these folks who are interested in that field and continue to not only support those who are in more traditional colleges and universities, but remembering also to support our historically Black colleges and universities, Hispanic serving organizations. We're all thinking strategically about ways to build the workforce to improve maternal and child health.
And I would just add, in a number of our challenges, we're exploring the role of doulas. So I know that there were some questions about doulas in the chat, and we're hoping to provide evidence of the positive impact of doulas, which will then hopefully increase funding for doula education and CMS coverage of doula support.
And one of the things we're doing on the tour is we have those walking alongside of us, actually helping to increase the doula workforce. We have now to date certified almost 400 doulas as part of the tour with culturally competent African-American doula women, as well as a few men serving as doulos.
Doulos.
So that's continuing.
You're on mute, Karen.
Thank you. I think that's a great note to end on, especially as we all note the importance of partners and family support in maternal health. I want to thank everybody for joining us today. To those that attended the webinar and those of you in the field, we know you're doing hard work. We are so appreciative. We look forward to collaborating and continuing to partner with you. And for those panelists on the line, thank you as well for demonstrating leadership and doing all of the great work across the department. Thank you, everybody. And as a reminder, the recording and all of the resources and links will be sent out in a follow-up email. Have a great afternoon. Bye.